Our incomes are raided left, right, center.
The government is becoming more immoral and acting in an unjust way to also take that only thing that we have to ensure that we have an access to medical care.
Despite paying very, very heavy tax, will now be the decision of a mere cabinet secretary with no checks and balances.
The workers of this Republic of Kenya have really suffered in the recent past. We are seeing now our pockets, our incomes are raided left, right, center. Currently, before this act came into force, there was a ceiling of 1,700, which was the maximum contribution to the fund. That is the NHIF. But now this is now an open check, whereby it will be determined by the cabinet secretary on what you are supposed to contribute, notwithstanding the services being reduced. We have been enjoying exclusive services from NHIF, whereby including the services abroad for special treatment and care. Our members have been flown out for specialized treatment. We feel that this act is punitive, it is retrogressive, it is stealing from ourselves the benefits we have been enjoying. The only correction which would have been done is to correct the issue of accountability in the NHIF, not now to create an amorphous, big opening whereby more accountability will not be achieved. Then we contribute more, we get less. The instruments which are indicated in the act to determine on who is supposed to contribute the 300, they are not clear. They are not clear. What parameters will be used to determine who is supposed to pay 300? What parameters are going to be used to determine who is vulnerable member of the society? So the whole act is unconstitutional, since it steals away from ourselves the basic right as enshrined in Article 43 of the Constitution on freedom to access health care services. So we say no, we say no, we say no to this. Thank you and God bless you.
Diana Gishengo, the National Coordinator, the Institute for Social Accountability, TITSA, and Okoa Uchumi. We are joining trade unions, and we are also joined by informal traders who are also deeply affected by the new Social Health Insurance Act that was hurriedly passed through both the Senate and the National Assembly. And a reading of that particular piece of legislation calls to question, who are these who are leading us in this country? This is a law that tries to completely centralize health, which is a devolved function, because primary health care is primarily offered by county government. The government has no business taking taxpayers' money to a fund. Taxpayers' money should be appropriated by county assemblies, and we all access primary health care in our basic public health institution. The other area that is very, very worrying is yet another attempt by this government to make sure that for our health that is now going to the private sector, that we must pay for, despite paying very, very heavy tax, will now be the decision of a mere cabinet secretary with no checks and balances. How we can move from the National Health Insurance Fund to a social health insurance that has no mechanisms for accountability. If anything, it creates multiple funds against the ongoing government processes for reducing state-owned institutions, corporations, and trying to bring them together. So this is a huge clawback. Health is a right. Most importantly is the fact that we are likely to get less, whether we are the informal sector, because you must pay upfront for a whole year, and or they throw in a package that if you cannot pay, we will give you a loan. What is wrong with this government and loans? Rights are rights. They should not be accessed through loans. And the loans that they have taken so far have affected us very, very terribly. So it is a continued mockery of the hustler, and we hope as we go to court, the real people who are Kenyans and all trade unions will stand up and we defend our constitutions. Asante.
Much has been said, but I challenge you to go and look at two items there. The definition of who a vulnerable person is in this act, and also the definition of emergency care, emergency treatment. Only those two. And remember, when doing so, health is a right, and attempting to push even private emergency care and leaving out the transport bit of emergency treatment in this act is actually commercializing and privatizing right to health in this country. Thank you very much.
Sentiments regarding Social Health Insurance Act of 2023 justifiable or they are outside the law. And in our discussions, we come to realize that in this country, public participations have been reduced to public manipulation, because from the memorandums that were submitted by these bodies, including Kenya Medical Association that was present in this particular gathering, we realized that the memorandums that were submitted by Kenya Medical Association, by the civil societies, by KMPDU, by FKE, by all these bodies, they were not looked into, and the advices, the proposals were not considered. And that's why we find this bill, as much as it comes out as a Social Health Insurance Act, it's more, and it seems, and it's quite clear that it's a vendor-driven venture. And now, why do we say that? We say that because for a long time, in the assessment of medical schemes, in the as well declared in Section 5 of these, the adoption of this particular act, Section 5 indicates that it will no longer be providing medical schemes and medical benefits. And we know, as has been outrightly explained, that in 2012, many of the medical administrative schemes or managers were seeking a mechanisms to ensure that the public servants were being managed within their schemes because they own insurance company. But this was very difficult because the Civil Servants Union stayed firm and refused that particular plan. We have seen that they succeeded in having the teachers and in having the police within that particular scheme. Now they were making it possible to have that scheme, to have the public servants go to that scheme by interfering with this particular act. And that's why it is very clear in this act that the Social Health Insurance Act will not provide that scheme to remove that competition. Yet we know that this medical administrative scheme charges 3 times that value. We know that this medical administrative scheme that is a conglomerate of private insurances are not in the benefit to actually provide care to the Kenyans, but in the business to make profit. That's why this bill is purely geared toward, it's actually private-centered. We are also seeing in this bill, in the management of claims, the claim management has put the powers to the minister without considerations of the board. And it has outrightly put who among the insurance company will take part into this, because it's an insurance company. And in that part, we know that when they are managing this particular insurance or this Social Health Insurance Act, they also own private facilities. So we are seeing a reductions in public health services. We are seeing a situation where money will be channeled to these particular medical administration services or schemes. And that's what we see to be a funder of this particular bill. Ideally, as we speak, we see to it that the 3 funds that have been put in place, that is the primary healthcare fund, the chronic fund, and the social health insurance fund, But the primary fund is a taxpayers' money. Chronic fund is taxpayers' money. But the bill is coming out to be very punitive to the Kenyans. Why? Because it's saying despite the primary fund and the chronic fund being taxpayers' money, you cannot access these funds if you're not contributing. You cannot access these funds if you are in the informal sector and you're unable to pay. So this makes this bill quite, in an essence, not able to increase the quality of care as it ought to be, but it looks strongly in a way that it is just manipulated to drive the agendas of particular private interest. We have also seen that the bill comes out and says that the regulations should be made by the boards. The boards have already been constituted, but the regulations have already been made. And we will see another aspect of public manipulation next week, whereby they'll be asking for views when they've already made the decision to the same. And therefore, as a union and as all civil societies, we've come together and we have gone to court. As KMPD, we have already gone to court over this particular Social Health Insurance Act. But now we've been joined by other bodies. We've been joined by Katiba Institute. We've been joined by other health unions. We've joined by the Union of Civil Servants. And we believe this case is not only for the civil servant. It's a case that is going to bring sanity in the health sector so that everybody can access care, so that we do not get discriminated, that if you are in the informal sector, you have to pay annually, and when you are salaried, you have to pay monthly. We have to put it into accountability, the role of Social Health Insurance Act, that the name that it has should go in line with the services it provides. Not that it has a name of Social Health Insurance Act, but on the side, it is a scheme to pilferage funds and to make Kenyans more poor. We have seen that in the last 1 year, we have been tasked in every space and in everything. The government will be becoming more immoral and acting in a just way to also take that only thing that we have to ensure that we have an access to medical care. Where the police and the teachers were taken. And we have seen some of the hospitals where police used to go and get medical care. These institutions owe them over 200 million. For example, hospitals like Shiromo hospitals, we have seen very many hospitals. And you realize that the same institutions own a big number of hospitals in this country, the Life Care, the Nairobi West. So it is the same institutions where money is being pumped, and then they're the same ones who manages the funds. So the people who actually have been suffering, and the records that we have, the reports we have in our documents, are that the teachers and the police are not able to access care. These are some of the institutions that are actually sponsoring and pushing on such bills to remove enhanced benefits of NHIF from the market at the benefits of those institutions. And we must say no. It is actually illegal to remove public money, public funds to private institutions. A public medical scheme needs to remain as a public medical scheme. It's also not any beneficial for the government to spend over 100 billion to private insurance companies when this money can be pulled together to make Kenyans access care. That's what we are calling for. And we stand by that. And that's why we are proceeding to take a very strong legal actions. And if it requires demonstrations and if it requires national strikes, we will proceed, because we cannot renegade on the benefits that we have achieved in our collective bargaining agreements.
I'm a leader in the informal sector, and I want to stand in solidarity with the rest of our colleagues. What we are seeing now is a peculiar, way of manifesting corruption, because anytime you privatize a right of a citizen, then you have no interest whatsoever to be able to adequately supply or provision the service that is due to the citizen. I want to take a different perspective to this. We have not seen any intentional resource allocation even for civic education. In the informal sector, how many people understand these acts? How many people understand these amendments that they are making? But we are seeing a rush, an unnecessary rush to push for taxes, to push for amendments, so that by the time we are able to disseminate this information to the informal sector, it has already been enacted, and we can do nothing much other than to petition and demonstrate. But this time around, we are declaring it is not business as usual. The informal sector stands in solidarity, and we shall mobilize every resource available in order to ensure that the citizen gets their right as required and as enacted in the Constitution. So I believe this kind of conversation should go to the necessary offices. Clearly, even someone who has not done much of schooling can see there are a lot of missing gaps. Anytime we do privatization of institutions, that is how we have killed the economy. And anytime we are not talking about production, anytime we are not talking about manufacturing, anytime we are not talking about value addition, how many SMEs right now have closed business? We are unable to supply. We are unable even to input in the economy of Kenya. Anytime we are not able to export our wares, our leather, you know, what are we doing to the economy? So anytime you want to tax more, it is also good that we put intentional resource even to this allocation. We are seeing minimum input of government, but maximum intention to reap out of where they have not sown. So with all due respect, let this go to the necessary offices. If it is about conversations, we are here. If it is about impunity, we are not part of it. We are here to ensure that the rights of the citizen are protected at all costs and at all deliberations. Thank you.
More Radio, 88.2 FM. We are in charge.